So guess who is back in hospital? I'm in the Shrewsbury Hospital in the surgical assessment ward. Lots of tests. Waiting for an ultrasound. Had a CT scan last night. Waiting for an ultrasound. So they said that I need to have a full bladder and then try not to pee when they push on it. Painkillers, got a cannula in, which bled quite a bit when they put it in, but I'm a bit of a bleeder, so not ideal. So the nurse just came round and said there's no time scheduled for the ultrasound. It could be in 2 hours, it could be in 20 minutes, and I need to have a full bladder. So she's given me a big old jug of water. So I've got a big old jug of water. I need to try and drink as much of that as I can. She said what might be best if it's soon and if I haven't had enough to drink is that they'll give me another couple glasses of water as I'm going down to make sure that my bladder is as full as it can be. Currently on paracetamol and codeine. There's a slight bit of backstory. For about a week I've had the most intense abdominal pains. Every time I move, it's pretty much stopped me from doing anything. Brought me to a halt, brought me to tears. At first they were very concerned that it was an ectopic pregnancy because my urine showed slight pregnancy hormones, so they were very concerned that it was an ectopic pregnancy, so they did more bloods that came back as negative, so it wasn't that. I've not been sick, I don't feel sick. I've lost my appetite with all this, but I don't feel like I'm going to vomit. So they don't think it's my small intestine, they don't think it's that. So they're checking now for ovarian cysts. So we'll see what happens. The CT scan showed inflammation. They just need to find why and where. Lunch has arrived. It's a bit of minced beef, some potato, veggies, and I think that was an apricot pie. I don't normally like custard, but I figured extra bit of sweetness. Best news, I can go home. Cannula is out. Ouch. You don't realise how much hair you have on your arm until they take those plasters off when there's a cannula in. A little bit of blood, but that's fine. I am being referred to the gynecology unit. I'm currently in the Shrewsbury, however you pronounce it, hospital. I'm being referred to gynecology at the Princess Telford Hospital. My ultrasounds are concerning enough. Something's going on, but not concerning enough to keep me in, thank goodness. So they're going to send me home with codeine, rest up, wait for the referral for that, and we'll see what's going on, the dramas. So I'm back home. Monday and Tuesday was in hospital. I know I mentioned on previous videos about some medical stuff that I've never really gone into. I did set up a separate medical channel to go through some stuff, but honestly I think I'm just going to post things on here from now on. So I like to keep this channel as kind of like happy Disney, Harry Potter, exciting stuff, but the reality is, like right now, I am not okay. It happens, life happens, things happen, you can't really do anything about it except just deal with them. Good days, bad days, happy days, positive days where you think, yeah, I'll get through it, and bad days when you think, why me? So a slight bit of backstory. And again, if you normally watch my Disney videos, please feel free, you don't have to watch this video. I just figured I would give a bit more context and information. So when I was 15, I had autoimmune hepatitis, which basically my immune system started, for whatever reason, they never figured it out, attacking and destroying my liver. So I went yellow. I had no idea what was going on. For years and years, I was on steroid medication, different sorts of medications to get that under control. And then I can't even remember years and ages anymore. It was at least 10 years after that. No, was it less? Right now I don't even know. They took me off all medication for it because it had settled down. They said it can come back at any point. It might not. We don't know. Keep an eye on it. Fast forward however many years, my immune system started attacking my colon, and they discovered I had ulcerative colitis. So in February 2020, I had surgery for that. They removed all my bowel, completely gone. They removed my appendix at the same time because the surgeon said that had started to slightly get inflamed. So obviously you don't really need your appendix, so they just took that out at the time while they were there. So I do have a stoma on, what's this, the right hand side, might be the left looking forwards on, but whichever. That has been a struggle. There are days when it doesn't faze me at all. There are days when I can't stand to look at it. Each to their own. Some people cope fantastically well with it. Like I said, there are days that it just doesn't faze me at all. There are days when I really don't like it, because I tried every medication that they had for ulcerative colitis, anything and everything that they had going. I tried it. There's potential for the reversal surgery, so they will just create an internal pouch. I'm not going to go into huge detail about everything. I'll pop some NHS links down below. If any of you have these conditions or would like to know a bit more, I'll pop NHS links down below so you can have a look. During the ulcerative colitis, I also developed asthma. Yay! So, not the best. And then a couple of weeks ago, just before this hospital issue started, I called the doctors because I was worried that I had started to either develop or have symptoms of vertigo. I'd often be just still and it would feel like the room was moving. Googled around Meniere's disease, which can have vertigo as a symptom. Since I was about 14, I've had tinnitus in both ears, and everything with Meniere's just fits what is happening. So I called the doctors about that, had some blood tests done for that, in which they discovered my liver levels were abnormal and high. And the doctor called me pretty much straight away and said it can be a one-off. So we'd want to do some more blood tests just to check. If they are high again, we'll refer you back to the liver team in case the autoimmune hepatitis is coming back. They would rather just catch that at the start. Second blood test done. Now, just before I got those results, I can't even remember how long ago it was now, last Wednesday or the one before, I started getting really bad lower abdominal pains. Sorry if this is gross, but females will know period pain. It was completely different to period pain. It was very intense and it got worse. So the Friday morning I did the online 111 kind of questionnaire because I just couldn't get through on the phone, and it came out to contact your GP now. So I called the GP up as soon as they opened, got an appointment for the Friday morning, went in. GP was lovely, took obviously a urine sample, no sign of infection, no sign of pregnancy. So she said sometimes it is just one of those things. She had a feel around in my stomach and said she felt like it was a bit inflamed around my bladder area. So she said, go home, rest, don't exert yourself, don't do anything. If it gets worse or it doesn't get better, then Monday morning, call us back, come back in. So fast forward to Monday morning. So Cat's just appeared next to me. Fast forward to Monday. So if you see his tail walk past in a sec. So, yeah, tail. Fast forward to about Sunday morning and I couldn't move. I was just in that much pain, laying in bed. Take away, silly. The cat's he's
been very cuddly with me recently. I think you can tell something's going on. They say that with pets, they can tell. So Sunday, I could barely move at one point. It brought me to tears. It was that painful. You sit down. So come Monday morning, and I was having paracetamol, and it barely took the edge off. It felt like it helped a tiny amount, but not that much. So call back Monday morning, went straight back in. They did another urine test, still negative for pregnancy, no sign of infection. Because at first they were thinking it might be a bladder infection. It didn't burn or hurt when I went to the toilet. I was still going to the toilet fine. So the doctor was quite concerned at this point and said, well, I'm going to call the hospital and get you in there because it's not right. Oh, excuse you. So he said if I haven't heard from the hospital in about half an hour to just go to A&E. I missed a call on the way back to getting home from a sister on the ward at Shrewsbury Hospital in the surgical assessment unit saying she was going to get me in there and not to go to A&E, just try and wait and then get in there. Got the next call. She said she would call back in like 5-10 minutes. Got that next call, went to the surgical assessment unit, and it just started kind of going downhill, really. Oh, I'm getting sidetracked, so my brain is everywhere. So they had the test results come back as well for the second bloods for the liver. Again, it was high again. It was abnormal. So I've also been referred back to the liver doctors. Yay, everything's going wrong. So went into hospital, into the surgical assessment unit. They took a urine sample, took some bloods, height and weight, blood pressure, all that fun stuff. Did a quick test to make sure I didn't have any viruses or anything like that. That was all fine. And the doctor came in and said, have you been trying for a baby because your urine test shows you're pregnant? And he said, with the pain that you have, like the intense pain, he said, I'm concerned you've got an ectopic pregnancy with this pain. And I was like, no, like we've not been trying. We've always said if we have a child, we have one. If we don't, we don't. Like we're being careful. Because of everything going on and potentially having different surgeries coming up, it was like not trying or anything right now. And he said, well, the urine tests aren't always 100%. They can easily be wrong. We'll do some more bloods and test, but that would explain the pain. And I was just sat there in a little booth by myself, because obviously with everything going on, everything's all cordoned off. Not allowed anyone in with you, not allowed any visitors. So I'm just sat there with my own thoughts, completely distraught, to be honest. I did have a mini breakdown. He came back in, said, nope, you're not pregnant. Something's going on, though, for urine test to come back. Because obviously they have better ones at hospital than at the doctor's. And he said, we need to get you a CT scan done, so we're going to admit you for the night, get a CT scan done, see what that shows, and go from there. So, had the CT scan at about 11 o'clock at night, which was really weird. The hospital was like pretty much empty. So that was a bit creepy. That's how horror films start, in empty hospitals. But they were absolutely brilliant. Had the CT scan, and it showed inflammation. I know you can't see it, but like in my lower abdomen it showed inflammation. They gave me codeine, which did help. I'm still on the codeine. The downside with that is it does make you a bit drowsy, which I feel if you see me looking up everywhere. Like it helps with the pain. Anytime I move, like when I stand up after I finish this, I'm going to be in utter agony, but the codeine helps, which is a plus. So the CT scan showed there was inflammation, but it didn't necessarily show why or specifically enough where. So they said, right, we're going to need to do an ultrasound scan because we think it's something to do with your womb, but not 100%. So the next morning, had the ultrasound. Oh, I very nearly weed myself. Sorry to say, sorry if it's too much information, but you know, when you've got a full bladder and then someone's pushing down on it, that was difficult. Didn't wee myself there, but they would have been lovely about it. They've said it happens a lot of the time. They said it happens more often than you think, so they were prepared, bless them. And then they said would send the results back up. Should be a couple of hours. Obviously these things take time. So the doctor came around afterwards and said, it was very peculiar at first. The first thing he said to me was, have I ever had a cesarean? And I said, I've never been pregnant, let alone had a child. And he went, And I was like really concerned at that point. I'm thinking, and then I had to question it myself. Have I had a cesarean? And then I'm like, no, I've never had a child. I've not had a cesarean. Why am I questioning it? And he said there's abnormalities and inflammation in and around the womb area. So he said they're going to refer me to the Princess Hospital at Telford, the gynecology unit ward. And they were very honest. They were very lovely. They were in a critical state for beds. They had too many people and not enough beds. Because I was still eating and drinking, I was still going to the toilet, everything like that was working. It was just this intense pain. They said, they did ask me, they didn't tell me. They said, are you okay to go home with the pain meds? And if it does get worse or like really, really bad to the point where I just can't move at all, to obviously come back. And I said, yeah, that's fine. Because the night before I barely slept. I'm used to sleeping in like a completely dark room, no lights on, and obviously they have to keep some of the lights on in hospital. There were machines beeping everywhere. I'm going to pop a quick clip of that actually. So there were machines beeping all through the night, people coughing all through the night. I barely slept, so I was like, yeah, I'm happy to go home at this point and just kind of go back as an outpatient for any more tests, which they were very grateful for, and I was grateful. It's nice just being at home and obviously not having visitors. It's hard doing that stuff by yourself. They didn't have any TVs in there, which I know like first world problems, but like just a distraction. So I was like on my phone most of the time. I spent most of my time on Instagram and TikTok just kind of scrolling through and distracting myself. So that was good. At least I did take my charger with me just in case, because I had a feeling that I'd be kind of staying in for at least a night. But yeah, just waiting now. This is why I've not done my hair. I've not put a face on. I just don't have the energy. Plus side is, at the weekend before, I felt something come in and I thought I'm just going to pre-record some videos. So I did that just to make sure I had content going up. And if hospitals are going to become a more regular thing, I'm going to have to pre-record a lot more stuff. Hopefully you're fine with that. So I'm currently waiting for more appointments for the Princess Hospital. The doctor said they will probably end up, he said obviously it's just his opinion, he's not sure. He thinks it might be endometriosis, I hope I pronounced that correctly. And he said if it is, they will do a laparoscopic camera. So they'll just make an incision in the stomach, pop a camera through and have a look at the outside of like the womb and uterus area, see what's going on. Honestly, at this point right now, I'm not hugely bothered what it is. I just want them to find it and fix it and sort it somehow. Whether that means surgeries, medication. At the point I'm in right now, I'm in that much pain, I'm not bothered what they do. I just want them to do something. So yeah, that's currently where I'm at. And I'm not gonna lie, it's frustrating. Yeah, like I said earlier, sometimes you just think, why me? It's hard. Like for the most part, I do try and stay upbeat, but it's hard. And then you think, why me? Why all these things happening? So yeah, right now is a struggle. But I have amazing friends and family who I wouldn't get through it without them. I know I wouldn't, and I'm welling up and I'm sorry. But yeah, we get dealt these things, we deal with them. For the most part, I do try and stay as positive as I can, but it's like everyone has down days. Everyone has days where they think, oh God, why this today? So, I mean, the cat sat down right next to me now, bless him, he's got his head on my knee. I think cats can tell, can't they? Animals in general. Yeah, they can tell when something's going on, bless them. So yeah, a bit more about me. If anybody was bothered, if you made it this far, thank you for watching. I did also actually, right now it's Friday afternoon. This morning was, to take it back to Disney and something a bit more lighter, this morning was the Mickey Mouse main attraction release. I did get the Loungefly backpack. I did get the ears, and I caved and got the key because I'm really interested. I want to see what it looks like. I don't know when it will arrive. It didn't let me do next day delivery, which I was hoping it would let me do express so I'd have it ready for Monday. It didn't let me do that. It said estimated it would arrive Friday. So potentially I do also have 2 other videos that I did record at the weekend as well, just because I didn't know what was going to happen. But I do have a couple videos ready to go this week. If Mickey arrives, or kind of any day up to he's not going to be here before Monday now because I didn't manage to get express shipping. If he arrives any day up to kind of like 3 p.m. Thursday, when I should be able to have time to unbox and then edit and upload, then it will be Thursday's video. If it is not, then it will be the following Monday. If I get them, I did see about 10 minutes ago one lady on a Facebook group who I think she said she ordered about 8:11ish, that she had a cancellation email for her backpack, and my order went through at 8:10. So I'm really, really hoping that I do get the item. Yeah, this has just been a bit more of a kind of get to know me with everything going on. I did post on my Instagram story about being in hospital, and a huge thank you to everyone that messaged me. It genuinely does mean the world to me. But yeah, that's a bit more about me. Feel free to ask any questions in the comments down below. If I remember, I will post NHS links just in case you wanted to read up on anything, if any of you are going through similar things. Some of these things are a lot more common than I realised, which sometimes you don't realise about these things until it happens to you or a family member. But a huge, huge thank you to everyone. Thank you all for watching. Don't forget to like and subscribe, and I'll see you in the next video. Bye.